Good morning and welcome back. Trinidad and Tobago, where we continue with the program. It's time for a second Tobago segment. The Pharmaceutical Society of Trinidad and Tobago is hosting its latest conference titled The Chronic Non-Communicable Disease Problem, Our Role in Combating the Problem. And here to tell us more, joining us from Tobago, we have Ms. Janet Paris, past president of the TPSTT and pharmacist. And we also have Mrs. Alison Pouchet, vice president, Pharmaceutical Society of Trinidad and Tobago. Good morning and welcome.
Good morning. Thank you for having us.
It's a pleasure having you on this morning, and let's dive into it. What exactly is the Pharmaceutical Society of Trinidad and Tobago all about?
Okay, the Pharmaceutical Society of Trinidad and Tobago is an organization that has existed since the 1800s, but it was formally enacted in 1925. And our past president, who is Ms. Janet Paris, she can tell us more because we revamped the TPSTT in 2009.
Yes.
Sure, Ms. Paris.
Good morning again. In 2009, after Trinidad and Tobago hosted the Caribbean Association of Pharmacists Conference, we felt the need to reorganize and revamp our society because we had a lot of young pharmacists coming on and they had no guidance and direction. So from then on, we have had the Pharmaceutical Society going.
Okay, great. And Ms. Paris, when we talk about, Ms. Pouchet rather, when we talk about the mission and vision of this particular organization, how would you sum it up?
Okay, I would say what we do is we provide opportunities which are focused on fostering high quality standards. And we also focus on improving the competencies, knowledge and skills of our pharmacists and by extension, other partners in the industry.
And how important is this actually, doing all of this?
It is very important because we can see our young graduates, as Ms. Paris said, grow from just having the knowledge out of university and growing to be able to work in teams with other professions. All of this resounds to the better outcomes of our patients.
And the focus is the chronic non-communicable disease problem. How would you describe that problem?
Well, the chronic non-communicable disease in Trinidad and Tobago, we have diabetes, and across the world we are number 4. That leads to morbidity and mortality. Then we have hypertension, we also have heart disease, we have cancer. That leads to things like kidney disease, amputations, blindness, strokes, and other issues that we have to deal with in the health system.
And would you say that as time go by, in terms with programs such as these and educational and awareness campaigns, do you think that this problem is a problem that is not as popular as it was in the past?
It is very popular because education for the patient is very important. Patients need to be educated because these diseases continue to impact the socio-economic lives and advancement of our population.
All right, so let's get into the actual structure of the conference, Ms. Alison Pouchet. How would you describe the structure?
Okay, it is basically presentations by very renowned speakers. We have with us Professor Surajpal Tilak Singh, and he's an endocrinologist. As well, we have Dr. Davlin Thomas. He is the CEO of the NCRHE. So he will give us a bit on quality. Then we have also our dietitian, Diane Charles, who will, of course, put in her part on nutrition. We have the podiatrist, Liana Huntley, as well as an exercise expert, Joel Joyous. And we have our young pharmacists who are going to be presenting their research and an action plan how pharmacists can become more involved in managing the care of chronic diseases.
And ideally, who would you like to see attend this conference? Who will it benefit?
I would say all pharmacists and assistants, as well as doctors, nurses, dietitians, and we focus mostly on the new graduate and the young practitioners because they have a lot to learn from their experienced presenters.
Have events like these in the past been well attended?
Yes, they have been well attended. We have always had annual meetings where we had maximum attendance of the pharmacists and the assistants. But we now want to invite the doctors and the nurses, the dietitians, the people who deal with foot care and that kind of, to attend our conference so that they could be part of our interdisciplinary team that needs to benefit the patient.
Wonderful. Ms. Boucher, when exactly is this conference and where will it be held? Just remind us.
Okay, this wonderful two-day conference will be held at the University Inn at St. Augustine. It's going to be coming off on the 21st and the 22nd of July. That's next week. And the times will be from 9 to 3 on both days. We also have a fee of $500 for registration, and that can be easily found on our website as well as our Facebook page.
Wonderful. And what are your closing comments, Ms. Paris?
Well, we would like to see wide participation in our conference because we need to have our lifestyle, healthy lifestyle promoted among all the disciplines in the health for the benefit of all the population.
Wonderful. And Ms. Boucher, your closing comments this morning.
I just want to ignite the passion within our healthcare workers for us to network and to create and share all this information. Because together with working together in this interdisciplinary approach and involvement of the patient, we can only see improvements in our outcomes. So I invite everybody to come and don't miss this conference.
Wonderful, ladies. It's been a pleasure chatting with you. Thank you so much for this initiative and taking the time to invest in the lives of our people.
Thank you
very much.
You're most welcome. We've been chatting with Mrs. Alison Boucher, Vice President, Pharmaceutical Society of Trinidad and Tobago, and Ms. Janet Paris, past President of the TPSTT, talking to us there about this particular two-day conference taking place at the University Inn from the 22nd to the 23rd of July from 9 a.m. to 3 p.m. The fee is just $500 and you're invited to go on their website for further information and registration.